I'm gonna kick us off for our whole coalition. I'm Catherine. I use the she, her pronouns. I'm calling in from Lynn, Massachusetts, so the Namkiag people. Um, and I have a disclosure to make. I have a sick preschooler here, so he has been set up with Peppa Pig iPad, but there is a non-zero chance that he appears at some point, so I apologize if that happens. Um, but is all part of the story of us getting to where we are as working mothers, working parents, community members, midwives, birth workers. So I want to kick off with a story that I think the timing of which is always one of those, like you marvel at how the universe works, but also it really anchors me in my meaning. We're going to go into lots of details about our credentials and our strategy and our political partners, but again, at our hearts, we are mothers, we are community members, we are family members. So I live in Lynn, Massachusetts, which is a what's called a gateway city. It's about a half hour north of Boston. It's a former industrial city, a very large sort of blue collar working class city, very, very big immigrant community. About 1 out of 3 people in Lynn is foreign born. And I was at a community event the week before the legislation that we're about to talk about passed. And a woman came up to me and she knew me enough to be like, "Are you a nurse?" And I was like, "No, no, no, I'm a midwife." And her face lit up and she turns out she was pregnant with her first child. And she was like, "I don't know if it sounds crazy, but I've gotten really into meditation and I just keep envisioning this home birth, like in the water with flower petals in the water. And do you know anyone who does that?" And I was like, "Yes, yes, I do know people who do that." Um, but as we continued to talk, the structural issues came in. So we had to talk about the fact like that it was not going to be covered. Home birth is not covered by insurance, and it was going to cost thousands of dollars out of pocket. And no, none of the hospitals in our area do water birth. And just all of these ways that the structures we have completely preclude people from accessing almost the most basic care. And, those conversations used to be so kind of heavy and kind of depressing. And I just felt like, in a week, this legislation is all going to be signed. And so maybe not for this baby, but for her next baby, that this was all going to be available to her and that it was going to be available for all Massachusetts families. That we were going to get home birth that's covered by insurance, that we could be moving towards 5 or 6 birth centers open instead of just one that we have right now, that we are moving towards guidelines where you should be able to get your menopause care, your abortion care, your gender affirming care in community birth centers that are trusted and that are thriving. Nashira, my boss, my colleague, my friend, who you're going to hear from in a few seconds. So she was quoted in the press right after the bill passed that this changes the game for generations. And I really just could not agree more. And I think I speak for all of us and all the coalition members that got this legislation through to say that it has been the greatest honor to have played such an important part of this legacy. And that's how we want to start this conversation. And with that, I'll turn it over to Nashira.
Thank you, Catherine. I'm Nashira Baril. I use the she, her pronouns. I'm calling in from the unceded Massachusetts territory, Boston, Massachusetts. I'm the executive director of Neighborhood Birth Center, a public health person by training, a daughter and great granddaughter of a midwife, and a two-time home birther. I am tickled, absolutely thrilled to be here with my friends and my co-conspirators. So you heard from Catherine, certified nurse midwife, policy director of Neighborhood Birth Center. You'll hear from certified professional midwife and international reproductive health strategist, Rebecca Herman, and Emily Anesta, founder of Bay State Birth Coalition, fearless advocate for repro justice, better known at the State House in Massachusetts than some elected officials are, and two-time home birther who was born at home herself. So we are a team of midwives and midwifery consumers working together with countless others in our ecosystem to change the policy landscape in Massachusetts and ensure equitable access to midwifery. we're really honored by this invitation to be here with you all today. So thank you to Birthplace Labs for having us. I was reflecting that in the frenzy of this end of year and seeing these friends all the time, to be here in this space, reflecting on this last year as the year comes to a close feels really special. Emily, Rebecca, Catherine, and I have potentially spent more time together this year than ever before. At one point this summer, Catherine told me that she was talking to Emily more than she was to her husband. So while we've all been like long involved in this work together, the introduction of a massive omnibus bill with multiple bills and pieces of legislation, after decades after the first bill had been filed, it really brought our coalition into deep alignment and deep strategy. And I don't think co-conspiracy is a bad word here. We were co-conspiring to change the landscape in Massachusetts. So our hopes today are to tell you more of that story, about the opportunities and barriers to integrating community midwifery, in particular into health systems where midwifery has been outlawed in the past. We want to share our strategies for assessing and addressing the political and regulatory context that has limited access to midwifery in the Commonwealth. We'll talk a little bit about the factors that were successful in our political strategy and how we centered those strategies on reproductive justice. And we really want to hear from you. So we're going to make sure that there's time in the end to open up for questions. So I'd like first to turn to Rebecca and invite you to say more about yourself and to ground us in the history of midwifery in these so-called United States and to set the context for how the landscape in Massachusetts got to be what it is all these years until this past summer.
Thank you so much. It's a real pleasure to be with all of you today. Seeing some old names in the participant list, which is always lovely, and looking forward to new friends as well. I think this picture says a lot. This is a rally at the State House and really reflective of the energy that has come together over decades. It really did culminate, but it has been a slow and then increasingly accelerating journey of momentum. If you want to go maybe 2 slides for, yeah, perfect. So especially, I know we have folks on this call from outside of the US, as well as maybe some folks who are in the US and less familiar with this history. I want to acknowledge that this history can be painful, and even for those who may not have personal ties to the history laid out on this screen, the themes and the familiar experiences of erasure, of misogyny can be triggering. So I hope folks have tea or a warm drink or a warm blanket with them. And we're going to move from here into a place of hope. So, as we all know, midwifery is one of the oldest professions in humanity, but going back well over 100 years, around the 1890s, the then sort of emerging obstetric medical profession took a really intentional campaign to sideline midwifery, to bring it into question, and to talk about the midwife problem, as you see published here. Fast forward a few decades, we had sort of a brief period of resurgence, recognition of the need for community public health corps, the need to improve care for moms and babies, recognition of how bad maternal and neonatal and child mortality rates were. And around the same time, we had the launch of what was called the Frontier Nursing Service in the southeast part of the country, and kind of the birth of what would become the nurse midwife. But there was a lot of political opposition. And the Shepherd-Towner Act itself would expire in 1929. You can see here these old political cartoons that took a really deliberate, racially charged tactic toward continuing to sort of sideline and marginalize midwives. And this came together and was really compounded by the overarching racism that pervaded the 20th century in the United States. I think most people will be familiar with, segregation and the Jim Crow laws and everything that, unfolded during the civil rights movement. The midwife pictured in that black and white photo is Mary Frances Hill. She's a midwife in Georgia, or was a midwife in Georgia, one of our grand midwives. But for midwives like her, that legacy was largely erased. And so by the time you got to the 80s and 90s, midwifery, both nurse midwives and certified professional midwives, had become an overwhelmingly sort of white profession. Certainly that was the way it was seen. The legacy of traditional midwifery and midwifery in other communities persisted, and continues to this day, but it was hidden from sort of the main discourse. And as a result, compounded with other issues, we have really struggled with issues of equity, with issues of access, and with issues of diversity. We also have that history leading midwives as a profession, and I am a midwife myself. We carry that, as part of our intersectional identity, is this knowledge that we are often seen as uneducated, as less than our physician, birth workers, that those really rich, in some cases, thousands of year old lineages don't have mainstream recognition. And it leads to sort of this inherent fear of persecution, of marginalization. And this will come up as you hear more about sort of the story that's unfolded in Massachusetts. Do you want to go to the next slide, Emily? So by the time we had arrived in sort of the 2020s, Massachusetts, largely known around the country and the world as a leader in healthcare, was not doing so well when it came to midwifery access or birth access. We we ranked 32nd in the country for midwifery integration out of 50. Of 400 birth centers operating in the US, only one was in Massachusetts. We had four, three closed over the last 5 years. And we actually were starting to see and have continued to see increases in severe morbidity as well as mortality. We had the benefit of a gubernatorial administration that chose to pay attention and commissioned a special report, a special commission to look at racial inequities in maternal health. And you begin to see attention paid to the many diverse factors that were driving this. That external event came after decades of our own work to try to advance recognition of midwifery and integration of midwifery in the state. And that was sort of where we landed in 2022 at the start of the legislative session, which culminated in the passage of new laws, which we'll be talking about. So I hope that grounds everyone a little bit in where we've come from. And I'm going to pass back over to Nashira to kind of take us into where we are today and what the future looks like.
Thank you, Rebecca. Just invite folks as we metabolize a reminder of that history to breathe and be into our bodies. it makes me think about the Sankofa bird and how we have our feet rooted in the present with our eye and heart to the past and informing how we move. I was thinking as you spoke, just to share the pin that I'm wearing, that's part of the swag. Oh, it says disrupt the system, not the birth. And that is like what we're in the practice of doing here. So given that history, Emily, can you share how we got here today to a multi-org coalition that's been strategizing for decades on all of this?
Yes, thank you, Nashira. Thank you, Rebecca and Katherine. I am really excited to be here presenting. This really feels full circle in a lot of ways. I mean, the birthplace lab research has been cited so many times. It's right here on this slide with the ranking Massachusetts as 32nd in the US for midwifery integration. So, as Rebecca talked about, people have been trying to change things in Massachusetts for a very long time. Massachusetts has that unfortunate distinction of being the first state to legally, formally outlaw midwifery in 1907. And nurse midwifery was only legalized in 1977. We were one of the last states to do so, and until 2012, the nurse midwives in the state could only work under the supervision of a physician and were actually barred from attending home births, and that changed with a bill filed by State Representative Kay Kahn. And that bill led directly to the opening of Seven Sisters Birth Center in Western Massachusetts and created opportunities for Neighborhood Birth Center and others. So advocates have been trying to get certified professional midwives licensed in Massachusetts since the credential was established in the 1980s. And advocacy begins with people sharing their stories over and over and over again, connecting their own experiences to the policy change that's needed. These policies, these state laws that determine who is licensed to provide health care, regulations on this, providers and sites of care have a tremendous impact on what options are available to us. And so, if the laws make it hard for a birth center to open in my community, maybe I don't have that option. If the law doesn't allow midwives who are licensed to attend home births, then that option may not be covered by my insurance. So this very intensely personal, momentous experience of childbirth is now profoundly impacted by the models of care, the providers, and the settings that are available under state laws. So there's lots of organizing that goes on behind the scenes. The pictures here are kind of the outward facing part of organizing. These pictures are taken over years of advocacy, and there's older pictures than that. And then behind the scenes, there's a tremendous amount that we don't have pictures of: the drafting bills, getting input from the community, sharing information about the legislative process, recruiting people to share their stories with policymakers at hearings, in written testimony, visiting legislators' offices, spreadsheets, emails, phone calls, door knocks. And sustaining this is the hard work of organizing. One of the strengths of our movement was the broad coalition we were able to form and mobilize around this issue. I helped co-found the Bay State Birth Coalition in 2016 to organize consumers and consumer groups. And by consumers, we just mean people, families, members of the public, who want to advocate for access to midwifery care and birth options, especially at home and in birth centers. And we started with the Certified Professional Midwife Licensure Bill, which had been around for many years already by that time. A handful of groups had been supporting this legislation for years. So I want to shout out our buddies ourselves, led by Judy Norsegian, and countless midwives. Rebecca's, for sure one of them, who kept the fires lit for so long. And then with Bay State Birth Coalition, we tried to push things forward by providing really sustained advocacy and presence at the State House. Thanks for that point, Nashira, about my relentless presence at the State House, and bringing families and individuals who want to share their stories there, and by expanding the coalition. You can see the many logos here of the organizations that were on board with us by the time this bill passed. Some of our partners included Reproductive Equity Now, the Center for Black Maternal Health and Reproductive Justice, Birth Equity and Justice Massachusetts, the ACLU, Resilient Sisterhood Project, eventually 30 organizations, including, of course, Neighborhood Birth Center. And this reflects the cross-cutting nature of birth justice, and specifically the type of care we seek out and the options available to us. This idea of access to midwifery, that we should have autonomy and choice in our care. This resonated with these organizations as a public health issue, a racial equity issue, a reproductive justice issue, a human rights issue, a feminist issue. So there's so many ways, I think, to connect to the bill that we were trying to pass and to the kind of broader concepts. And these organizations lent expertise, capacity. They mobilized their members, their audiences. They used their connections and their platforms. And this dramatically amplified and extended our reach far beyond a small group of midwives and home birth families. In 2020, the Massachusetts Senate unanimously passed the Certified Professional Midwife Licensure Bill that had been filed at that time by Rep. Kay Kahn and Senator Rebecca Rausch. That bill ultimately died when it was not brought to the House floor for a vote before the end of the session. However, that year, the legislature did pass a bill filed by Senator Liz Miranda with Senator Rausch and Rep. Kahn to establish a statewide commission on racial inequities in maternal health. This was the first time Massachusetts has ever had a legislative commission made up of where the majority of the commissioners were Black women. These commissioners were community leaders, healthcare providers, people with lived experience with pregnancy and birth. And the commission held listening sessions to get input from people across the state. So in 2022, that commission published a report which outlined stark deficiencies and inequities in Massachusetts' maternal health care system. Despite, as you heard, being often considered a national leader in medicine, Massachusetts was experiencing rising rates of maternal mortality and severe morbidity, growing racial inequities, and declining access to care. And all of these are preventable. The commission made sweeping recommendations across many aspects of maternal health care and beyond, particularly highlighting the benefits of expanding access to the midwifery model of care, home births, and birth centers. This helped to establish midwifery as a key solution to the maternal health crisis facing the state. The commission specifically recommended the adoption of midwifery legislation that had been languishing in the State House for many years. Despite this, a few months later, those midwifery bills were killed in legislative committee. So the legislation had to be refiled and start all over again in 2023. And with that, I will transition back to Nashira to bring us to how we got our bill over the finish line in 2024.
I'm like, thank you, Emily. It's so sobering. I was here for some of it. I was part of it, witnessing it, but to hear it all in that timeline and all of the effort, and it was killed, and all of the effort and the defeat. And we're going to take you to the other side of the success. So, Katherine, you have been advocating on midwifery policy for years through the American College of Nurse Midwives, Massachusetts chapter. So this advocacy as a midwife wasn't new to you, but you were in a new role, new for you and new for us at Neighborhood Birth Center. I know that most birth centers don't have a policy person, and I was borrowing a page from Birth Detroit, and we committed that part of our role in advancing access to midwifery in Massachusetts wasn't just to white knuckle it and open Neighborhood Birth Center relying on philanthropy and prayer to stay open, but to open sustainably and to disrupt the system, not the birth, and make change on a structural level so that we and other birth centers could thrive. And so I couldn't be more thrilled, and the return on investment of bringing on you as a policy person it continues to magnify. So, Katherine, can you pick up the story from there, where you came in and what it meant to have a developing birth center in the fight for this legislation?
Yeah, thanks, Nashira. And Emily, we can change to the next slide. So, as Emily said, I mean, these efforts have been happening for a long time. We had, but a little bit like in our own sort of somewhat professional divided lanes. I mean, Rebecca sort of said we've got the certified professional midwife, got the certified nurse midwife. And in Massachusetts, we've been very supportive of each other, but never really totally collaborative in our legislative strategy. And I remember it was the summer we found out that all these midwife bills had been sent to study, aka like, they died like in the legislative. And I was pregnant with my second. I was lying like flat on a couch. And I talked to Emily and we just raged for a while. But I think out of that, there really was this like, aha, like, okay, like I think we've been at this for a decade. Like, let's try something different. And so, what we began to do in a much, much kind of more intentional way is actually for there to be a robust and bold midwifery agenda. And that, again, that idea that this agenda stated that midwifery is a central solution to the maternal health crisis, and we need to advance every part of the profession. So the so in our state, we were like, the state can't say in one report they want more birth centers, but then not give them the staff or the workforce to work there. We can't say that people deserve all these birth options and then not have anyone pay for it. And so we were able to begin to we had three separate policies with like three, they were filed as separate bills, but basically anywhere we went, we talked about them all collaboratively. So the first being, of course, the pathway to licensure for certified professional midwives, which was going to create a board of midwifery, a CPM majority board of midwifery. It was going to allow certified professional midwives prescribing abilities. It was going to be able to allow certified professional midwives to staff and work in birth centers, and it was going to ensure that certified professional midwives were reimbursed for their services regardless of site of service. The second part was the reimbursement parity for certified nurse midwives. CNMs in the state had had independent practice since 2012, but we were still being reimbursed 85% of the physician rate for the same service for anything, birth, pap smear, IUD, everything was getting 85 cents to the dollar. So this would bring us to 100%. And then updated birth center regulations. The Department of Public Health in Massachusetts sets the birth center regulations, and ours are onerous, costly. I mean, we used to say they were like archaic, but that would like imply that they were at some point anchored in some kind of any point in any kind of evidence. They just were very sort of hospital focused, like medical focused. They just were not appropriate, and they were very, very out of line from the American Association of Birth Center Standards. So those were our three major policy points. Where I feel like the magic, the opportunity of having somewhere like neighborhood birth center suddenly in this policy range, in this policy world, is that NBC, actually, Neighborhood Birth Center, brought all of these policies all together. And we also had a real platform. Neighborhood Birth Center has a lot of people from community level to city leaders to the State Department of Public Health to the governor's office that are really eager to see us open and thrive. So when we went to lawmakers and said, hey, we are struggling to open under these guidelines, or we can't stay fully staffed unless you license certified professional midwives, or we really can't even keep the doors open unless you pay our clinicians fairly, it gave lawmakers really concrete examples, and it added urgency. Neighborhood Birth Center, we'd already bought our land in Roxbury. We wanted to be open yesterday. And it was a way of getting lawmakers to say, here, come together. Let's work together to get us open. The other thing, I think, what bringing birth centers into this is it kind of eliminated or neutralized some of the challenges around the CPM licensure. So where the CPMs or home birth could just be dismissed as like too few people, too niche, too crunchy, not a public health priority. Or also as crippling is just getting into this like spiral of like, is home birth safe? Is home birth not safe? And with everyone sort of dueling away around like which evidence they're citing or how they're interpreting that evidence. So actually bringing birth centers in and focusing on certified professional midwives and midwives in general as the workforce, as a really necessary workforce, it sort of widened the conversation. And then you could say, listen, everyone deserves access to the care that birth serves them. And this is not a niche issue because this is going to impact every single birthing family in Massachusetts. The end result, and we can go to the next slide, the end result was the trailblazing maternal health omnibus. It was unanimously passed by the state legislature in the summer, and it was signed into law by Governor Maura Healey in August. The bill is anchored in reproductive justice and the care we know helps all birthing people and their families grow and thrive. It included almost everything we ever could have dreamed of. The Board of Midwifery for Certified Professional Midwives with full licensure, and the ability for midwives, certified nurse midwives, and professional midwives to open, run, and staff birth centers, updated birth center regulations. It is getting nurse midwives at 100% the physician fee through our state's Medicaid. We did not get the private payer. We'll go for that again, but just an enormous, enormous achievement. It also has provisions around doula care, postpartum home visiting, perinatal mental health, lactation care, among other things. So it was a blazing success. The magnitude of the success is a total testament to advocacy and passion. We hope that's clear. But it also is around political strategy and perseverance. And that's the conversation we want to get into now with all of you. So I'll turn this back to Nashira and she'll guide us on that discussion.
Thank you. Katherine opened by saying she has a sick kid at home, and I have an annoying puppy that won't go outside because it's pouring rain here in Boston. So I'm hoping she doesn't bark while I'm off mute. We have a little bit more we want to share now, and then we're going to open it up for questions. We've talked a lot today, or we've used the term reproductive justice a lot today, and I want to just ground us explicitly in the definition of that, and really attribute that framework to the National Black Women's Reproductive Justice Agenda and the Black feminists who gathered in '94. This year we celebrated 30 years of the movement for reproductive justice, and they gathered after feeling unsatisfied and largely left out of the global reproductive health narrative and the pro-choice movement. And so they developed a human rights framework for women of color and low-income women. And so I'm just going to share that here and I will drop it in the chat. I'm sure it's familiar to this audience, but it feels really important to be explicit and to honor that history. Reproductive justice is defined as the human right to control our sexuality, our gender, our work, and our reproduction. At the core of reproductive justice is the belief that people have the right to have children, the right to not have children, and the right to nurture the children we have in a safe and healthy environment. And so reproductive justice guides all of our work. And I'm wondering, among the four of us, who wants to just jump in and talk a little bit about how our commitment to reproductive justice shaped our strategy really explicitly.
Kick that off, Nashira. I mean, I think people have already heard, some of how this shaped it. It really was the core as we grew and strengthened the coalition. If you think back to those logos that Emily, shared on the screen, not all of them are explicitly midwifery organizations. Not all of them are even explicitly healthcare organizations, but they are all grounded in social justice and reproductive justice. And this was so important, not just from the lens of helping our legislature and our policymakers to understand why these policies matter, but also to helping different stakeholders sort of recognize that we actually do have a shared agenda, even when we have some of these historical differences. Um, so, for example, and I see a lot of CPMs on the line here, so this will be familiar to many of you. Questions around regulation are very divided in the certified professional midwifery community in the United States. We tend to pride ourselves on just how sort of client-centric and therefore individualized our model of care is. The idea of regulation, of being part of the system, can be scary. But when we begin to help midwives understand this is an equity issue, this is a reproductive justice issue, this is going to open doors to assisted conception for queer families. This is going to open doors to medication abortion. This is going to open doors to all sorts of things. It becomes a very different conversation. When we're no longer talking about, well, do we need to trade? What happens when the doctors try to pit the nurse midwives against the CPMs? And it's just, to Catherine's earlier point, this is about the fact that if we want community birth access, if we want birth options, we need all the midwives we can get. And we need all the credentials of midwives. And it allowed us to really forge this very deep, genuine coalition alignment that I don't think was possible before this was our guidepost.
I'll just add to that really briefly. I think that was very well expressed, Rebecca. And thank you, Nashira, for the question. One of the ways also that it showed up is really giving an opportunity for, let me back up. When we talk about the racial justice aspect of reproductive justice, and Rebecca mentioned that, that legacy of our country's history with midwifery and how that's played out in Massachusetts has resulted in pretty white midwifery workforce, as well as, pretty white clientele when it comes to like the home birth clientele accessing CPM services. But when framed around reproductive justice, when there's opportunity for individuals and communities who maybe want to be a midwife or want to have access to these options, or want a Black midwife for themselves or a midwife from their community, whatever that is, and framing it around reproductive justice, but also around really aspiring to what's possible. And I think that the bold midwife agenda really did that. Instead of talking about little like incremental baby steps of saying this could all be different, we could all have these resources in our communities. We could have midwives and birth centers everywhere. I do think really is part of what the reproductive justice framework offers in terms of how to think about it. And it's exciting and it's engaging and mobilizing.
It makes me think about the work of Dr. John Powell and the framework around targeted universalism, that like it's only when we get really clear about the ways that inequity play out structurally and impact us all differently, that we can develop strategies that are targeted to those that experience the most structural oppression and inequity. And from that place, we can develop universal policies and programs and systems that then lift all boats, right? And so I think that being really clear about, I've been in public health in Massachusetts for 20 years, and we've been just leading with the data of racial inequity, often in a really painful way. And that's that's not our practice in this coalition and a neighborhood birth center, but we lead with the data and then try to coalesce others to feel bad for Black folks who are giving birth in the hood versus saying this is also important to wealthy white women in Brookline who don't have access to home birth and to midwifery to, it's just, I think it's like, it was a really important framework to invite everyone into the idea, to seeing themselves get free. I think at the core. So, we've been talking a lot about the success of this, and Emily, and when you were sharing, like, the road to get here was long, and there were many legislative sessions where we left in tears and felt defeated. The question is about pushback, right? Can you pull back the curtain a little bit, even if you want to quote without saying who they were? What was the texture of the pushback in those early years, and how did that inform the strategy this time around? Because it felt like we weren't going in, maybe what I just said, we weren't going in kind of like leading with Black Death. We had a different strategy. What was the texture of the pushback, and how did we integrate that into our strategy this time?
Yeah, thanks, Nashira. So some of it was alluded to before. For one, this idea that this is a niche issue, and I think Katherine spoke to that really well. When we were talking about when I first started advocating around CPM licensure, for example, the idea of CPMs in a birth center was such a distant dream where the only birth centers we had in the state were 2 hospital-owned birth centers. And the regulations were terrible, and we weren't looking, we were sort of taking one step at a time at that point rather than let's go for all of it. And so the idea of CPMs and home births did seem like a very niche issue to many legislators. And I think what Katherine said about birth centers, but also the breadth of our growing coalition, really served as a counterpoint to highlighting how broad the support for it really was. And a lot of misconceptions, things like, well, if maternal health outcomes are bad, doesn't that mean we need more medicalized care, more people in hospitals? A lot of myths around the safety of midwifery care, the safety of home birth, false false ideas that midwives, and a narrative really from particularly from the physician industry, that midwives, especially those who are not advanced practice nurses, are not educated or safe. And this really harkens back to that racist and misogynist campaign that Rebecca talked to us about. And we've not shaken off the legacy of that. Some of this, though, changed over the arc of my time going back to I first started advocating for this in 2013. As for one thing, the body of research grew, and I do want to shout out Birthplace Lab as well as Childbirth Connection and the Uplift Lab, among others, that made it very plain not only the safety but the benefits of the midwifery model of care and community birth, which really teed up things like then in 2022 that commission report highlighting midwifery care, including out-of-hospital birth options and CPMs as a solution. And we spent a lot of time over many years educating policymakers on this, and that's where the continuous presence at the State House and having lots of opportunities for policymakers to learn about the issue, to learn that we do need to improve our maternal health care system, and the benefits and skills that midwives bring was essential. And then all our coalition partners and folks and families that were mobilized, they were armed with the facts and the myth busting to then confidently respond to misinformation, and really allowed us to take the advantage of the opportunities when we're talking about deficiencies in our maternal health care system. We're talking about a birth center closing in Massachusetts, or data coming out about declining, increasingly poor outcomes, and we then were teed up with all the answers and dispelling the myths and lack of awareness people had of midwifery.
Thanks. I'm eager to open it up to Q&A. I just wanted to see if any of you wanted to say any more about the portal that we talk about that we feel like has been open. I know, Katherine, you touched on it a little bit. I think we all touched on it a little bit, but like, I don't know if it began with COVID, but I certainly mark what felt like this portal opening with the impact of COVID and the just like the overnight increase in the demand for home birth, and also the ways that it exposed all that it's fraught and broken in our current healthcare system, mixed with the response to the murder of George Floyd, and then Katherine spoke to like the alignment from city level to the governor's office in Massachusetts right now. And I think that, I'm thinking about just like we've been working and we were like organizing and ready, and then this like portal opened and it was like go time. So I'm wondering if anyone wants to just say any more about the portal.
Yeah, I can say a few things to, as Nashira said, this sort of portal stars aligning of like where everything came together. I think, there are wonderful things about working in a state like Massachusetts. As, we've said, like our governor was, like focused on this. This is a state that feels like it's a healthcare leader, invests a lot in healthcare. It's a state that takes reproductive rights very seriously. And codified as soon as even before the Trump administration came in, codified abortion. So there's great people, but the downside of that is you can also very much get a lot of like this feeling that this is not a problem for us. This is, that's a problem in other areas of the country. Like we're a leader. What are you talking about? Best healthcare in the world. And so all of these things together, like the COVID sort of exploding and sort of blowing up our systems and having no infrastructure of being able to get people to birth safely outside of the house, out of the hospital. The focus on George Floyd and the racial inequities that were in Massachusetts that were with a doubling of the maternal morbidity rate. The fact that we had 11 maternity care closures, how tiny our state is, 11 since 2010, 6 of those since 2020. And so there just was this like, for the first time, I felt lawmakers like, wait, what is happening here? What do you mean it's closing? And then this is the master of advocacy. There was a lot of, in the North Shore up where I live, there was a birth center closure, and the consumers there were very huge advocates, very, very savvy in how to use the media, and got a lot of publicity. And again, back to like the amount of expertise, the amount of relationships we'd all been building for a decade, we'd see these windows and we were like right there. So like Emily, who'd back to the lab, she was like, you remember those closures we're talking about? Here's another one in your district. Like, and we could just mobilize really, really quickly, and really sort of make the connections very explicit to lawmakers of what they were seeing.
Maybe just to add on that, that ability to respond quickly and to leverage the moment that we were in over the last few years isn't accidental. And I think it's something that I have thought a lot about and been really grateful for with this coalition over the last year. I am based here in Massachusetts. My clinical home birth practice is here, but I work globally. I work in countries throughout sub-Saharan Africa and South Asia. And often it's on policy and advocacy issues. And it is time consuming. It takes strategic skill, and this is full-time work for a lot of people. Whether that's paid or unpaid, whether that's our sort of families who maybe experienced a loss or maybe just were really frustrated with thinking they were going to have a birth center birth and then the birth center closing when they were 36 weeks pregnant, but really pouring themselves into that advocacy, or whether it's people who, who have a paid professional, um, policy focused job, that's what enabled us to respond to current events. And I think often where I see things not moving as well, it's that investment hasn't happened, and that sort of recognition that like this takes time, this takes people, and this takes investment to be able to take those moments, seize the media, seize the thing. And it's just been such a gift to work with people who understand that and who appreciate it and who are willing to put in the time.
Well, I very much agree with everything that you all have said. And just to add that, I think the coalition was ready to take advantage of the opportunities that we had, and capacity offered to us by, organizations that had, a connection to a key person in government, or were able to bring some volunteers to help us organize people at our rally and visit legislators. All of those pieces add tremendous capacity, because midwives on call and families who just gave birth, who tend to be in a lot of ways, the drivers who want to move these things forward, don't tend to be the ones that have the most capacity to show up all the time and respond quickly. And so it was really exciting, and I'm just so proud of all the work we did together, that we were ready when the opportunity came, and we did it.
Thank you. On behalf of Willow and I, thank you to my friends. It's just been a treat to look back at this with you all. And I think at this point, we're ready to turn it over to Tamara and open up for Q&A.
Great. Thank you to Emily, Katherine, Nashira, and Rebecca. You're doing such important work to combat the just deeply historically entrenched barriers to midwifery integration and community birth and just general reproductive care. And you can really see the way your commitment to reproductive justice has just completely driven your work. So thank you.